I'm here with Andy Carter. He's the president and CEO of the Hospitals and Health Systems Association of Pennsylvania. Andy, thank you for being with us today.
Thanks for having me. Greatly appreciate it.
So, with hospitals under stress at the moment due to coronavirus, how has the pandemic affected hospital revenue in Pennsylvania?
Profoundly. It's only beginning to be understood by Pennsylvanians that the relentless march of this virus is leading to staggering financial impact. And here's why. The hospitals readily agreed with the governor and the secretary of health that it was important to suspend our non-emergent surgeries, procedures, x-ray services, and office visits to help control the spread of the virus, and also to save equipment in case there was a huge surge. And shutting down all those services, which account for a huge proportion of a hospital's revenue, is having a staggering effect. And we're estimating that lost revenues are mounting up to upwards of $1.5 billion, and that's with a B, every month that this crisis continues. And then on top of that lost revenue, hospitals are getting ready. They are hiring people. They are buying extra supplies. They are bringing new beds online so that they're ready for a surge. And those costs add, we estimate, another $500 million a month. So we're talking about a strain on hospitals across Pennsylvania totaling $2 billion every month this goes on.
So this loss is attributed mostly to those suspended services. Do we have any idea when those services might be able to continue?
Well, we're working with the Commonwealth on that very question. We want to make sure that before we resume non-emergent surgery and services, that we can do so safely for the patients, safely for the healthcare professionals, and certainly to do so without adding in any way to a resurgence of the virus. So we're following both national guidelines as well as the considerations being taken by the Secretary of Health to identify when that time is. For example, most experts believe that we shouldn't move forward on opening up these kinds of services unless we have adequate testing capacity so that we can determine who has the virus or who is a potential carrier so that we can isolate them and keep them from patients that might be coming to hospitals. That's an example of a step we need to take before we can really resume full bore non-emergent services in hospitals.
And do you anticipate that this trend of loss will continue even after the coronavirus curve starts to slow down?
Our members and HAP are looking at a range of models that project the trajectory of this virus and its spread. And models point to the fact that while it may peak in Pennsylvania in the next week or 2 or 3 weeks, that it will continue for many weeks thereafter. So the projections we believe now that are credible have us managing these kinds of losses for at least a total of 4 months, and certainly could go on even longer, particularly if Pennsylvanians let their guard down too early and don't maintain social distancing for as long as the experts advise us to do so. We've been able to avoid some of the worst projected surges, in part because Pennsylvanians have done a great job following the governor's orders to stay home if they don't have to go out. And that has helped slow the rate of growth of the virus. So we should all, as Pennsylvanians, be pretty proud of that, but we cannot become complacent.
What solutions has your organization proposed to help hospitals who have suffered financially?
Well, we've got a range of solutions to suggest. I do want to start, though, by emphasizing the most important focus for hospital leaders and for all the healthcare professionals working in hospitals has been to be ready, to be sure that the equipment and supplies are there, to make sure that we've expanded capacity, retrofitted facilities, put the word out to recently retired doctors and nurses to come back to work. We've worked with the Commonwealth to cut through a lot of red tape that makes it hard to surge your capacity for this event. That's been job one, and doing so in a way that protects the safety of workers and patients. That's why we've worked so hard to try to expand access to all these so-called personal protective equipment, face masks, shields, surgical gowns, all that keep healthcare workers safe from infection. That's been our top job. Now, we have also been tabulating what the financial loss is. And so in recognizing that it's as much as $2 billion a month, we've come up with a plan that will help relieve that tremendous financial strain. First, we're asking that the Commonwealth, by May 1st, waive a requirement that hospitals make a total of about $500 million in payments to support the Medicaid program. Now, we support those payments in normal times, but in this crisis, with a cash flow disaster unfolding in hospitals, we're asking for the Commonwealth to relieve us of that responsibility for making those payments and to cover those costs instead from the general fund. So that's one. Two, joining all the healthcare providers in the Commonwealth, we're proposing a coronavirus emergency relief fund. And that fund is designed to be administered by the Department of Health and for providers to make applications into that fund for reimbursement for costs and lost revenue that are not taken care of by the federal stimulus program called CARES. And then finally, we want to work with our partners in the health insurance community to provide as much relief as is possible from a number of administrative requirements, and then to try to advance cash payments that have not been coming because so little health care has been provided over the last month. And then I guess actually there's one more proposal we have. We are trying to protect healthcare workers from liability for anything that might happen during this emergency, even if they are acting in good faith. Right now, if we don't get an executive order from the governor or legislation enacted by the General Assembly, those healthcare workers could find themselves being sued, even though they did everything possible to provide the best possible care. And under these crisis conditions, if a bad outcome happened through no fault of theirs, no negligence, no gross negligence, but just a terrible situation, why, it's got to be terrifying to them to think that they could be sued. So we're just asking for protection from those kinds of lawsuits during this crisis.
You mentioned making sure that healthcare providers have adequate supplies such as masks and gowns was a big priority. From the beginning of this pandemic, why was it a challenge to make sure that hospitals were getting this? Because it didn't seem like they had adequate supplies from the beginning.
Unfortunately, the virus's impact started in other parts of the world before it came here. And as a result, there was a huge drain on worldwide supplies of this equipment. And that's the fact. A worldwide pandemic puts a huge strain on the entire healthcare supply chain. All these masks and gowns and personal protective equipment, but also on vitally needed pharmaceutical products, ventilators, which are that life-saving equipment that keeps people breathing when they're in a respiratory crisis. The worldwide demand, the world wasn't ready for it. Now, hospitals have been working cooperatively with help from HAP and with help from PEMA and the Department of Health to try to move supplies around to where they're most urgently needed. And we look forward to continuing to do that as the supply chain issues resolve themselves. Now, we're not waiting for that to happen. HAP has been partnering with the Chamber of Business and Industry and PA Life Sciences to help connect PA's manufacturers and other sources of equipment and supplies to our hospitals to try to restore depleted supplies where they exist. The good news is that today, even though we have occasional pockets of supply problems, overall, Pennsylvania's in decent shape. We track closely in concert with the health department and PEMA how many days of supplies we have on hand throughout the Commonwealth. And today there are places where people may only have about 3 or 4 days of personal protective equipment on hand. But we're tracking that closely and doing all we can to address the places that are at most risk of running out.
And just to clarify, you mentioned that a lot of these supplies are coming from Pennsylvania manufacturers. Is it mostly Pennsylvania manufacturers, or is it a combination of others from different states and other places?
I'd say it's coming worldwide. Shipments are coming from around the world. Manufacturers are stepping up to try to do what they can to retool their manufacturing resources to make some of these supplies. But it's coming around from around the world and around the country. There's no single source or single magic bullet. We have to count on the entire supply chain answering the call for help.
What are some things that average people who aren't sick can do to help alleviate the stress on hospitals?
That's a wonderful question. Fortunately, there's a lot they can do. Much of it's really relatively easy. I'll start with, if you can, stay home, except for those life-sustaining trips to the grocery, and if you're involved in working for a life-sustaining business. Otherwise, if the more you can stay home, the more you're able to slow the rate of spread of this dangerous virus. And we have to maintain social distance. Obviously, it's important to go outside and get some exercise, but when you do so, please stay away from everyone else, at least 6 feet, if not a little more. It's hugely important. Second, people have been very kind. If they have supplies that they can donate, there are places they can go to. They can come to our website, haponline.org, and they can find a place to let us know about supplies that they can donate. There's also a portal in state government that they can go to, both businesses and individuals, and let government know what they have, and then there can be help connecting these supplies with the organizations, including physicians, nursing homes, community health centers. All of us are in this together, and all of us have needs for this equipment and supply.
Aside from shortages and staffing issues possibly, are there any other challenges hospitals and the general healthcare system are facing that people maybe don't know about?
Well, I think certainly it's a challenge to recruit enough trained healthcare professionals to prepare. We're in great shape today, but if the worst projections unfold in the next few weeks, we could have pockets where we simply don't have enough healthcare professionals working to treat and save patients. It's one reason why we work very hard that for those workers that are on the job, these heroes of Pennsylvania healthcare, doing everything we possibly can to provide them the equipment and supplies they need to remain safe. And we follow CDC guidelines, and we work so hard to make sure that these healthcare heroes are protected from getting the illness themselves. That said, they still are falling victim to the virus, sometimes, of course, in healthcare settings. But they're also falling victim to it when they are in the community. And that's one reason why, I ask Pennsylvanians to play the role of hero themselves by staying home, because the last thing you want to do is, if you don't need to be outside, wouldn't you feel badly if you encountered a healthcare worker and ended up infecting that worker? That'd just be a terrible shame.
Looking towards the future, you alluded to it earlier, the importance of being prepared. How can we ensure that our hospitals and our healthcare workers are adequately prepared with supplies and just general staffing in the future, should a situation like this arise again?
I think all of us as Pennsylvanians and Americans at the end of this, we're going to have to take a close look at how this virus unfolded and how the healthcare system responded. And, in the healthcare business, whenever there's an adverse event, teams of professionals get together to do what's called an after-action review and to look at what worked and what didn't work. And it's pretty clear that um, the lack of testing supplies, the shortage of personal protective equipment have played a huge role in compromising our initial response. I think we also are going to have to take a look at all of our long-term strategies for adequately financing the healthcare delivery system. Part of the reason we're facing this tremendous stress is that we came into it in a financially vulnerable position. Before this started, last year, a third of hospitals were operating in the red, and another 20 to 30% were operating with very thin margins. So we've been under great pressure to reduce costs. And I'm not saying that's not a good thing to do, but we have to make sure we don't go too far. We have to have the ability to stand up emergency capacity when a pandemic happens. And we are all pretty sure from what the experts tell us, this is not the last pandemic that most of us who are alive today are going to experience. The risk of another one is high. So we have to take a look at what readiness really looks like now that we've lived through something that humankind hasn't seen in 100 years.
And finally, financially, how soon do you think hospitals will be able to recover from this situation? And are you hopeful that it'll be able to happen soon?
If we act swiftly, for example, if we waive those payments that are due on May 1st and June 1st, that will help shore up stability. If we establish the emergency response fund quickly and give hospitals and other providers access, that will help us recover more quickly. However, the idea that we'll be back to normal in 6 months or even a year is almost certainly not going to happen. We're imagining a period of years to return to the kind of healthcare delivery system that Pennsylvanians want, which is a high quality, accessible, and affordable delivery system. And this is taking a huge hit on all our plans to deliver exactly what people are asking for. But the faster we act, the sooner we'll be able to recover.
All right, Andy Carter, President and CEO of the Hospitals and Healthsystem Association of Pennsylvania. Thank you so much for your time.
Thanks for having me.
We have 3 branches of government: executive, legislative, and judicial.
Voting is a civic duty. Voters are an integral part in government operations.
When I run for office, you can be my campaign manager.
Do you have a child curious about civic engagement? Support their passion with PCN Civics 101, a free online resource presented by the Pennsylvania Cable Network. Easy-to-watch videos take learners into the Capitol to see how our state government functions, meant to enhance your child's classroom studies. Go to PCNTV.com to start watching. PCN Civics 101, teaching Pennsylvania politics and policy.
I'm here with Josh Schwartz. He's an employment attorney at Barley, Snyder Attorneys at Law. Josh, thank you for being with us today.
My pleasure. Thanks for having me.
So for people out of work, either if they were laid off or they were forced out of work because their business was forced to close, to start off, how can someone apply for unemployment?
So the website, the unemployment website in Pennsylvania is up and running. I would just say Google Pennsylvania unemployment, but I certainly can, if before the end of the interview, I can look up the URL specifically. But it's an online application. It is fairly straightforward. My understanding is that they are less backed up now than they were a couple of weeks ago. Initially, there were a number of, not problems, but just some delays in people getting PIN numbers, which is the first step in being able to file a claim, and then some delays in getting the checks out, but that those are becoming much less frequent. People are starting to see their benefits. In addition, the federal $600 additional benefit is, I believe if it hasn't started being paid yet, it is getting started this week or next week, according to the latest information from Pennsylvania unemployment.
And for people who aren't unemployed, their job is still working, but they've had to cut their hours, are they still able to apply for unemployment as well?
So it actually depends on how much your hours have been cut. There are two means by which employers can make it so that cut the employees' hours sufficiently so that their employees are eligible for a partial benefit. The first is through what's called a shared work program in Pennsylvania, and that is something that an employer has to apply for before an employee applies for unemployment benefits. The way that works is that you would agree to cut everyone in a certain category of employee by a particular amount, say 20% or 30%. And then if you're approved for the program and you maintain that level, so everybody in that employee classification working the same reduction, it allows an employee to get a little bit more in unemployment than they otherwise would, or oftentimes, this is where this comes into play to answer your question, it allows people to get unemployment who would not otherwise be eligible. Because in order, outside of the shared work program, you really do need to have a significant cut in your compensation per week in order to be eligible. The way that unemployment works, and without getting into all the mathematical calculations, pretty much it requires at least a 35 to 40% cut before you're financially eligible to receive unemployment in Pennsylvania. And you have to be financially eligible at all to receive any of the federal additional benefits that are triggered by the Federal CARES Act.
And you mentioned the CARES Act. That was put in place to help increase eligibility and alleviate the stress on businesses. What specifically does the CARES Act do?
So the CARES Act does a number of things, actually. There's a small business administration loan program that businesses with fewer than 500 employees, with some exceptions, there are actually some businesses that have over 500 employees that may qualify as well, can get certain loans to fund their payroll and certain mortgage payments, certain other qualifying expenses for a period of time, and those loans become forgivable. There is an employee retention credit where all companies, as long as they sustain some kind of loss associated with the current environment of a sufficient amount, can take a payroll credit up to $10,000 per employee over this, or annualized $10,000 over the course of a couple of months. And then what I've been dealing with a lot is the boon to the Unemployment Act. So from an unemployment perspective, the CARES Act put into place, first of all, anyone who is eligible for unemployment for COVID-19 related reasons, meaning they are either partially lost their job or fully lost their job, or need to stay home because they are experiencing symptoms, or are caring for someone whose school has closed and is thereby eligible for unemployment. Any of those people get an additional $600 per week in addition to what they would normally get under Pennsylvania state law. That extra $600 goes until the end of July. They also expanded eligibility to additional categories of people. Some of them specifically COVID-19 related, like I said, if you're home with a kid or you're experiencing symptoms, but also it extended the categories of people, including gig workers, self-employed individuals who would normally not be eligible under Pennsylvania state law at all for unemployment, now are eligible if their loss in compensation is due to the current economic downturn or the government's closure orders.
Do people who made an unemployment claim before this pandemic, will their claim still be processed, or should they maybe cancel that one and make a new one so that they can apply to these new measures that have been put in place?
Well, so no, I mean, if your claim is active in the system, then it should continue. And keep in mind that the CARES Act changes to unemployment really only apply to people who are eligible because of the COVID-19 related issues. So if you were laid off in January because of a downsizing, you should have been getting benefits for a few months already, and you should continue to get benefits. You don't need to start a new claim or anything. On the other hand, if you are a gig worker and you were you lost compensation, let's say back in January, February when the pandemic was starting, but before the CARES Act went into place, you probably would have gotten at the time some indication that you were not eligible and a denial of your claim. If you're in that situation, you should reapply because the CARES Act changed your eligibility.
For those whose jobs are continuing, but they cannot work either because, like you mentioned, they have to take care of someone who's sick or for child care reasons, instead of applying for unemployment, can they get paid sick leave?
So it depends. So the federal government passed a bill called the Families First Coronavirus Response Act a week or two before the CARES Act passed, and that provides a paid sick leave benefit for employees of employers that have fewer than 500 employees. So on the smaller side of employer here. If your employer qualifies, they should have already posted a notice in the workplace about your rights under the FFCRA. That requires paid sick leave if you fall under one of several categories. So if you yourself are experiencing symptoms, or you have been advised by a physician to self-quarantine because of exposure, symptoms, positive test results, or if you yourself are subject to some kind of government order to quarantine, either because of your travel recently or something like that. The governor's general order in Pennsylvania wouldn't qualify generally to everyone, but if you're specifically, because of your circumstances, are subject to a government order, then you're entitled to 2 weeks of paid sick leave, up to 80 hours, at your regular wage rate with a maximum of $500 per day. That is a fully funded benefit from the government through your employer. Your employer pays you, but then your employer gets a payroll tax credit instantly from the government. Also, you are entitled to less, but still some sort of paid sick leave if you are either a caregiver for someone who is experiencing symptoms, testing positive, or otherwise quarantined, or if you have to stay home and are unable to work because your child's school or daycare is closed because of the governor's closure order. Under those circumstances, again, if you're working for someone that has fewer than 500 employees under the FFCRA, you're entitled to up to 2/3 your regular wage rate for 2 weeks, up to a maximum of $200 per day. And then the final piece of this FFCRA is you're also entitled, just with respect to this school closure issue. So if you have childcare responsibilities due to the school closure, you're entitled to 12 weeks of job protected leave, the last 10 of which you're entitled to, again, the same kind of 2/3 pay up to $200 per day. So for some people, that is going to work out better than unemployment. And of course, if your employer has work available for you and you can't work for one of these reasons, you're entitled to this sick leave, so you wouldn't even be eligible for unemployment. And obviously those two things, the sick leave and the job protected extended leave, they work together. So if the only reason you're eligible is because of this child care issue, then you would use the first 2 weeks of unpaid job protected leave as this paid sick leave piece, and one would kind of swoop in, and then you'd be entitled to 12 full weeks in a row of paid leave.
For businesses that are still able to operate, what are some things that employers must do to ensure that their work environment is safe?
So this is cutting edge stuff right now, because just last night, or yesterday afternoon late, the Secretary of Health, Dr. Levine, put in place a new order for public health measures for employers. So all employers of businesses staying open now must provide their employees masks and require the employees to wear them. You also can approve if an employee has its own mask or has created a mask or wants to wear their own mask, you can approve that, that's fine. But you also must enforce social distancing, at least 6 feet between employees. You have to have protocols in place for cleaning, sanitizing. The cleaning, sanitizing protocols have generally been in place for a couple weeks already. Most employers hopefully have had those in place for a while. The masks are new. The there are also some additional protocols for situations where you have somebody test positive in your workplace. If you have experienced someone or you have exposure in the workplace, whether it's somebody who works for you or someone who came in and they've tested positive, you have to engage in significant cleaning and closure of the area where they were for at least 24 hours. You also have to notify any employee who was in contact with that person and follow CDC guidelines, which may mean quarantine or advising some of those employees or all of those employees to self-quarantine for a period of 14 days. You also must implement temperature checks. Again, not all employers, but if your workplace has been exposed to COVID-19, then you need to implement temperature checks when people enter and or when employees enter, and not let anybody in if they have a temperature of 100.4 or above. And then obviously, if any of those employees who were exposed to someone who then later tests positive, that starts the process over with now anyone who was exposed to them in accordance with CDC guidelines and doing cleaning procedures again. The rules also apply to places that are open to the public. So if you are a store that is considered an essential business, other than a food store or where you're selling medicine, and for those, you can have an exception if you have other means for people to get in, like delivery or curbside pickup. But for most places, you have to require your customers to wear masks as well. And if they're unwilling to wear a mask, you have to not let them in. The only exception to that would be if somebody has a medical condition, like an asthmatic condition or some other breathing difficulty, then they don't have to wear a mask. Or no one under 2 has to wear a mask. And I think that's probably because I have young kids. If somebody was 2-year-olds wearing masks, they're going to be touching their face a heck of a lot more than they would otherwise, and probably are tearing them off.
Well, a lot of businesses, for safety reasons, are switching to working remotely. What sort of risks or concerns should employers be concerned about when making that change?
Yeah, telework, obviously that's what I'm doing right now. A lot of employers are switching to that. One thing I did want to mention, we talked about the CARES Act and unemployment and the FFCRA before. If your employee is able to telework, then they're not eligible for any of these benefits. Both the FFCRA and unemployment require that your employer can't provide you telework, or there's some other circumstance that means that you can't telework. Either your child care responsibilities are so significant that you are unable to fulfill the responsibilities of teleworking, or you have a power outage in your house and therefore you can't telework. In general, telework often presents a lot of challenges. This is true outside of a COVID-19 outbreak as well. Work injuries that occur in the home office are compensable under the Workers' Compensation Act, and they are OSHA recordable. That's Occupational Safety and Health Act. So I generally advise employers that they should put together remote work policies. And in those policies, make clear to your employees that they should maintain a safe working environment, that their home office shouldn't have any exposed wires. They should try to eliminate obstructions between, let's say their computer and their printer. There was a case a few years ago in Pennsylvania where a woman had a studio in her garage that she worked in, and then another location in her house, and she tripped on her dog walking between one and the other, and that was considered a work-related injury. And so, these are the kinds of things that you want to be careful about. Not that you can control everything as an employer in the home work environment, but you should have policies in place to try to make sure that employees are taking precautions. Other issues, obviously, certain employers have confidentiality concerns. Their client information, it might be confidential, or they themselves may have confidential information that their employees are dealing with. They may want to put certain restrictions in place on their employees about printing at home, or about the location of their computer, so that non-employees can't go up behind them and see what's going on their work desk. Obviously in the middle of a national emergency and statewide emergency, where a lot of these telework arrangements are relatively last minute, I've been telling people to do what they can and be reasonable and have reasonable expectations of their employees. But they should be aware of these risks about the remote work environment that may come back to haunt them later on.
And as a final thought, your firm has been working and advising people throughout this pandemic. What are people's biggest concerns that they've been bringing to you and your firm?
So I'm in the employment practices group, as it's probably clear from not only my intro, but the things we've talked about. I have been getting a lot of questions similar to the ones we talked about today with respect to the FFCRA, the CARES Act. A lot of employers are in the odd circumstance where they have a number of furloughed employees that are frankly now collecting more in unemployment than the employees that they may have still working. And how do they deal with those employees just as a human relations matter? They have angry employees that are coming to work and are earning less than their colleagues who were laid off for a period of time. I've been telling those employers they may want to consider some sort of hazard pay during this period of time and bump everybody's wages. That's not a legal issue, but it may help retain your employees, make them happier. Unions have been active in this period of time, as you can imagine, and so employers that aren't already subject to collective bargaining may have some concerns around keeping their employees happy and trying to avoid a situation where they have a strike or where a union comes in and interferes with the relationship with their employees. So all kinds of things. And then, the regular stuff too, that just because we're in a national emergency doesn't prevent regular old work injuries from happening and performance problems from occurring, and discrimination claims are still getting charged. So we've been dealing with all of it. We've also, obviously, colleagues of mine have been advising a lot of employers around the loans that we talked about before, the payroll protection plan and the employer credits, things like that.
All right. Well, John Schwartz, employment attorney at Barley, Snyder Attorneys at Law. Thank you for your time.
Thanks, Leah. It was my pleasure. Take care.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm talking today with the president of the Erie SeaWolves, Greg Coleman, playing minor league baseball in Erie since the mid-1990s, and they're right now a AA affiliate of the Detroit Tigers, and Greg is in his 10th season with Erie. April 16th was supposed to be opening day for the SeaWolves. Greg, you were supposed to open up against Altoona. Obviously that, like the rest of the sports world, unfortunately right now is on hold. So it's a different world for you and your front office staff every day, I'm sure, of what you're doing now as opposed to what you expected to be doing right now.
Yeah, certainly. This time of year, we would normally be doing something along the lines of a 16-hour day, making sure that we're, dotting all the proverbial I's and crossing all the T's, whether that is making sure every seat has a cup holder, a sticker on it, all the programs get printed. I mean, it is a race to the finish line. And right now, you sort of feel like, boy, I'm missing something.
You'd really like to be running around like a chicken with your head cut off right now, wouldn't you?
You know what? We sort of thrive on that. We enjoy that race to the finish line every game day.
So I know one of the things that you were looking forward to, something that you got started in Erie over the course of the off season, and you were starting to unveil, and that's some major renovations to your ballpark. Yeah,
UPMC Park was built and opened in 1995, and it has had a few minor renovations since then, but they were minor. And in the last couple of years, we've been working with the governor's office, state of Pennsylvania, our local officials to make wholesale improvements. Last season was the 25th season. It's time, and was built for a lower classification of baseball. It was built for the New York Penn League, which really operates from mid-June through Labor Day, and didn't have some of the amenities that you might have for AA baseball. That's both from a player development standpoint with outdoor batting cages. We didn't have hot water in the restrooms, which is kind of important in April in Erie, and a place really for folks to meet and gather. I mean, the biggest space we had was a a 20-person suite, and really having 20 people in there, you had to have half them on the balcony. So, really, it remedies some of those full season needs. We're a good chunk of the way through, but construction had to stop with the governor's order. We certainly understand why. But once things get up and going again, and we get ready to play some baseball, all of the things we expected to have ready for opening day will be, and a few things that we're going to finish late, we'll finish a little later.
So with that in mind, let's say baseball returns to Erie, hopefully sometime during the 2020 season. Can you still do some of those renovations during the season, or will you have to shut all that down until the season's over with and then start them back up again?
No, we'd be renovating during the season. We were already going to be doing that. There's a space in left field, a brand new building that's going to house a meeting space, kind of a stadium club of sorts, and a new team store. We've been the only Eastern League team without an indoor merchandise store for a decade, and so those things will trail a little bit. Those were going to be built in season or finished in season, I should say. And they'll now be finished in season. They'll just be finished later in season. So we had to adjust some of our forecasts for the fact that some of those spaces would be, coming online in August instead of July.
So you mentioned, and we talked about the fact that the SeaWolves are now part of the Detroit Tigers minor league system. You're the AA affiliate of the Detroit Tigers. And in the time that Erie has had a baseball team in the Eastern League, you've gone through a couple of different organizational changes through all of that time, through the 25 plus years. So what has the marriage been like with Erie and Detroit?
No, it's been great. It's been great. The Tigers, this is actually going to be our 20th season with them. We were an Angels affiliate before then. And then, as you mentioned, we were, a Pirates affiliate before then. And so it's been fantastic. The Tigers are good partners. They are, for a number of years, they had a lot of success at the major league level. And in recent years, they've struggled a little bit, but that's actually been to our benefit, where we've seen some of their top prospects. I mean, we had 4 pitchers come through our system last year, our team, in Casey Mize, Matt Manning, Tarek Skubal, and Alex Faedo. That very well could be the Detroit Tigers starting rotation in 2 or 3 years. So good partners, love working with them, and very supportive of the team and what we're doing in Erie.
Yeah, well, that's the one thing about being a minor league affiliate. When the big club, in this case Detroit, is going through what the Tigers are doing, which is a wholesale changes, and the Justin Verlanders of the world get traded, that brings in prospects, which brings guys into Erie, and it's to your benefit. Yeah,
it absolutely is. I mean, we see it. It's an impact on not just on the team, but on tourism in Erie. We'll see. It's like clockwork. Memorial Day weekend, we're home. You'll see all of a sudden, you'll see Michigan license plates. You'll see orders online of tickets from the Detroit area. It's impactful, and it's great for the local economy.
Absolutely. That's a great point, because you're bringing a lot of people into Erie, and it's true for all the minor league teams. And that's part of what we're discussing as we're talking about this with everything that's going on with COVID-19. It's in Erie, it's in Altoona, it's in Reading, it's in Scranton, it's in Allentown. All across the state of Pennsylvania, minor league teams are being impacted, and tourism is being impacted, because you're not bringing all those people, those thousands of people, go out to watch minor league baseball every night over the course of the summer.
Yeah, I tell you what, I've been doing this now 22 years, and I haven't seen anything that's had the impact like this. I mean, we saw slowdowns in the business from 9/11, certainly the recession, 2008, that took its toll. But there's no one who is not getting touched by this in some way, shape, or form. And certainly, obviously, everyone's health and safety is first and foremost, and I think we all understand that. But it is tough to not be able to play exactly the same role that we play normally in our community. I mean, we can still do things. We can still keep people entertained on social media. We can give back and support, causes in the way that we can. But it's tough to not be able to see your family. And for us, the folks that come out to the ballpark, we've got people that have been season ticket holders for 25 years. They're our family. So it's tough to not be able to have the impact that we might have on their lives and on our community the same way.
And I guess that's a great way to segue into my next question, which is really kind of the elephant in the room. And that was Major League Baseball. There was a release late last year. I think it was around November. A story came out where Major League Baseball was talking about making some cuts to some of the minor league teams, just in a simply an act of saving money, to cut some of the volume of teams. And in that release, one of the teams that was mentioned was the Erie SeaWolves. So obviously you've had to have an impact with that. And let me give you an opportunity to give kind of the SeaWolves side of that story.
Well, sure. I would start by saying that we certainly were surprised when we learned that our name was on the list. We've made investments to the facility. The state has supported that the last couple of years. Last season, we completely renovated the playing surface. Obviously, the renovations currently going on both impact player amenities and also fan amenities. So really, the only thing when this whole thing is all said and done that won't be touched from a player standpoint will be the clubhouses and their plans to do that. So. So we feel pretty good about where we are. Frankly, we are a little bit suspicious with Major League Baseball, knew exactly what was going on in Erie, Pennsylvania. The Tigers were surprised that we were on the list. They've been great advocates for us. And I know that when they found out about our situation, they were on the phone with the commissioner's office to kind of find out what was up. And so over the last couple of months, we've learned a lot, and we have felt pretty good about the situation we were in heading into 2021. We still feel pretty good about that. I think, obviously what's happening now with the virus and the economy and things like that it shifted the landscape for a lot of things and a lot of people. But I think we felt really good before all of this started that we were going to have baseball in Erie in 2021, and we'd be the AA affiliate of the Detroit Tigers.
But it had to obviously have an impact with you. I mean, you have to do a great deal of work in the off season with sponsorship and season tickets and all that kind of things. So it had to be a little bit more of an unstable off season than you certainly knew what was going to happen long before COVID-19 entered into our vocabulary.
Oh, certainly. I mean, we had to have conversations every single time we walked into a room as to what our situation was. I mean, it just didn't matter. That was the first thing before you could get to the idea of renewing a sponsor or selling a ticket. Hey, what's up with the team? What's happening? Tell me more. So every single conversation we had to talk about construction and contraction, and now we have to talk about coronavirus. So it's the 3 COs this offseason. It did zap some energy, particularly the couple of weeks after the announcement was made, because everyone, bless them for sure. They all wanted to know how they could help. But it was every single person wanting to have an individual conversation. And that's not always the most productive way to go about things. And so, but we know for about 2 or 3 weeks afterwards, we had to play PR. We had to have a lot of conversations. We had to plan. And those are things that, look, we plan every off season, but we don't plan for that. And so it zapped some resources, but we knew going into this year that we are already going to have a lot of things to be excited about with construction. So we just tried to make sure we kept focused on what we had to do.
Well, let's hope there is baseball in Erie in 2020. And if there is, give some people an idea what is on the schedule if you want to come out and watch baseball in Erie in 2020.
Yeah, so it's our 20th anniversary with the Detroit Tigers, so we're excited about that. We are using that opportunity to celebrate some of our more recent prospects. Casey Mize was the #1 overall draft pick in 2018. He was with us last year, and just world-class guy, world-class talent. We figured we're not even waiting for him to make the major leagues. We're going to get a bobblehead of him out into the marketplace. So we're doing that. We're certainly known for our great fireworks shows. You can watch them up close and enjoy them. And so we've got a whole slew of those that are on the docket. And so we're having fun. And now the promotional schedule is going to have to be changed. I mean, we had nights from fitness night to outdoor night. I mean, all kinds of different themes that we might have. We're going to have to reshuffle some things. The one thing we won't reshuffle, though, we have a Hawaiian night that is on the schedule. Where we'll play in special Hawaiian themed jerseys. Last year, we had a terrible loss in one of our players named Chase Numata. Played for us, also played for Reading in Pennsylvania, and he's from the state of Hawaii. His birthday is August 14th, and we're going to have a night to kind of honor his memory, raise some money for charity. He was an organ donor, saved a couple of lives by the donations that he made. And so, that's locked in. We're going to celebrate that even if we don't have a game.
That's what's the beauty of minor league baseball. It's always something for fans to do, and it's a great night out. And let's hope we're playing baseball sometime very soon.
That's what we're hoping for. So we look forward to seeing the fans out there.
Greg, thanks very much for spending some time. Greg Coleman, the president of the Erie SeaWolves.
Thanks.